Hi, I'm Dr. Mohammad Aalai with Pain Free Lives, and I just want to talk to you guys today about some small things that usually are missed by most people when they're dealing with pain management patients. So this category of patients, there's a lot of concerns, there's a lot of specific things that you have to kind of be aware of. That's why it's kind of good to see a specialist for any pain concerns, because you never know where pain from just the tip of your finger could be coming from, or maybe on your ear, your head. You never know, okay? So the first thing I would say is one of the biggest things that's missed in pain management. Patients tend to stay on anti-inflammatory medicines for too long. So that would be things like Advil, Naproxen. Those types of medications can only be taken for short periods of time. They have a lot of wide-ranging side effects that can actually end up causing problems for your kidneys. They can cause problems for your stomach. They can cause significant problems for your organs, and you can end up having bleeding, which is not great. They definitely have caused that type of problem for me myself when I've had taken them for a variety of problems. So even a young, healthy person can end up getting a lot of issues from taking anti-inflammatories for a long period of time. Something like Tylenol, you can take that more frequently, and I would say it's like safer, but definitely getting to the root of the problem to try to find out what's wrong by seeing a specialist is important. Even if your primary care doctor gave you some tablets and said, just take some Advil, it's okay. You have to be very, very careful with those medicines. They sell them over the counter, but they can kill you, and it's one of the leading causes of death that no one talks about. The pharmaceutical companies don't really discuss this, okay? Another thing I would say is when you see a doctor, in general, a lot of times they want to, go according to the guidelines in terms of giving you physical therapy, giving you medications, stuff like that, before getting any imaging or further diagnostic tests. Generally, what I'll tell you is that this is definitely important, but when you reach that threshold where you should get imaging and more invasive testing, it is important to get that done. I've had patients that had neck pain that they didn't know what it was from, and I did an MRI, and God forbid this ever happened to anyone, but they ended up having a tumor in their lung. So withholding imaging is not something I do, because patients deserve to know what's wrong with them, especially if it's something that could be very serious, and catching it early could be very life-saving. So that type of thing is something that we try to focus on, getting diagnostic testing at the appropriate point when things are not going in the right direction for patients so that they can have the best outcome. It's very important. Last thing I'll say is ignoring red flags. So patients that have problems with pain is a long spectrum of disease, but things can happen that make it more worrisome, such as if you start having numbness in your groin or in your rectal area, you can't feel in that area, sensation is poor. This is a really, really big red flag. It's a large concern. If you're having fevers, chills, night sweats, weight loss, these are concerning. There's a lot of things that you need to inform your doctor about, especially if they're things that are new and you're not used to them, because these can mean that there's something more serious going on. So even if you have chronic pain and you've had pain for 20 years, if new things start happening, you need to be aware that you should tell your doctor, because there might be something more serious going on. So generally, just wanted to kind of touch base and let you guys know what you should kind of be looking for, especially if you've been dealing with pain for a long period of time, and things that are usually missed, such as these. It's very important to have a thorough history and physical exam, proper diagnostic workup, and obviously see the correct specialist so you can get the best care. All right, guys, as always, like, follow, and subscribe for more content. Talk to you soon.